I'm murdered. Yeah, yeah. Coming up next on Mental Health Matters with Marty, we're back with the doctors. We're talking about women's health issues. Stay tuned. Hey, y'all. Welcome to another edition of Mental Health Matters with Marty and featuring House Calls with the Doctors with Dr. Allen. We are so glad that you're joining us on this Wednesday. And listen, we hope you have been enjoying our shows. So let me jump to it real quick. If you're going to be engaging with us, we want you to go over to Mental Health Matters with Marty. And we also want you to go over to our Marcel Media YouTube pages. On there, we can definitely see your comments. We definitely, if you have questions for the doctors tonight, you've come to the right spot. Yes, these are live practicing doctors. They are doing it in their cities and they are doing it all the time. So you've definitely seen them come in and out because some of them have been in surgery, some of them have not. So listen, that's what we're talking about. But let's make this clear as well. Mental Health Matters with Marty featuring the doctors. It is to supplement your mental health and wellness and your physical health and wellness journey. We are not, let me repeat that, we are not a substitute for your journey. We are not a substitute, but we are a supplement to give you information about how to live the best life possible and some of the basic things that we can do. But this show is recommended to give you the information so that if you're experiencing any type of crises, we want you to go to your nearest urgent care, call 911, or definitely at the least make an appointment with your doctor and your therapist. You know, I got to throw that one in there for free. So again, hello, everyone. Hope you are doing well. Let us know that you're listening. Let us know where you're at. Let us know what's happening. Again, we just want to make sure. Yes. Hey, great. See, we got this. Who is this? Daryl, my stuff is in the way. Listen, Janice, how are you? Glad to see that you're with us. We appreciate that. Blessings to you and your family as well. But listen, hope everyone is doing well. We are having some hot days out here in Southern California. But our topic for tonight, fibroids, fertility, and your future. Discussion on women's health, fibroids, fertility, and your future. Now listen, if you're past the fertility moment, we still want you to know this information so that you can share with other women everywhere. So listen, call your nieces, call your daughters, call your aunties, call your grandmama, call your auntie, your best friend, your cousin, your good girlfriend, and everyone else as we're having this discussion. But I am so glad that on this doctor show, I don't do this by myself because I know nothing about that. Now, if we're talking about the mind, we can have a conversation. But we're talking about physiological health. I need someone who comes in here. So glad to have my co-host with us live from Gardena, California, none other than Dr. Gwen Allen. Dr. Allen, how are you?
I am great. Great to be back. I hate that COVID, people think COVID is over, but I'm back full swing of things and people
Yeah.
are coming into the office at 101% and
Whew.
we're back, and that's
Yes.
why
Yes.
we decided today just to go back to our roots
Mm-hmm.
and talk about the
Okay.
things that are pertinent to us and women's health. You got
Right.
three OBGYNs on your show. And
Right.
unfortunately, today, Dr. Giselle Hawkins is not with us. She's
She's
going
out delivering a
delivering.
baby, isn't she?
Yeah, she's out delivering a baby. And each one of us had his turn. One time it was me, the other time was Dr. Horn, and now, it's Giselle. It's the way the cookie crumbles. We're going to miss
Yeah.
her
But can you
input
tell these
tonight.
babies to quit coming during our show?
Right. I really want them to stop. It's like, hey, give us a
Right.
break at least for an hour, then we could be okay. But I guess they just
Right.
said, I wish I could have it where the babies come between 8 to 5 where I can sleep all night. But
Right.
that just
Right.
won't happen at this point. So, but again, I am happy to be here. And like you said, it's 100 and some degrees. I'm exaggerating. It's like 85, 90 degrees, and people are out. People don't have their mask on. I'm still wearing mine. Mine is still right here. I don't
I
care what's
have mine too.
happening.
That's right.
You
See, Dr. Allen,
know,
I live in the desert, so we push the high 90s. We've been in triple digits all this week, so
right, right.
Ugh. But
And that's
how
what I said.
have you
I can
been?
imagine. I've been good. I just left from Chicago. I had a birthday,
Okay.
and Jamie had a birthday, and we up in Chicago.
Yes.
Had a great time, and now I'm back in the swing of things, and it's just a doozy. I need some personal time. I need some mental health time, and so hopefully
Yes.
that we can get that. And mental health is very important. We've come out of
It
COVID,
is.
and now we're back in the swing of thing. And actually, it went from 0 to 60 overnight.
Mhm.
And
Didn't it?
sometimes you just have to really say that. I need a break. I need a break already,
Yes.
and
Yes.
so, I'll be calling you on your phone to say, hey, Marty, I need to talk to you because at
Yeah.
this point, I got used to relaxing, and now I'm in
Hmm.
the swing of thing 110%, going miles an hour. We're back to delivering, we're back to operating, we're back to all these
Right.
things. And so that's why today we decided to do fibroids, because now we're back to operating, and women are coming in after COVID,
Okay.
and
Okay.
people are depressed that they can't have children, or
Right.
someone told
Right.
them that they can't have children. And
Right.
so we're here today just to open up the can of worm and say, what are fibroids? Why are they common to Black women?
Mm.
Why they have infertility issues, or what happened
Mm-hmm.
to them after menopause, and
Mm-hmm.
how that
Mm-hmm.
all plays on the psyche. Can you imagine
Mm-hmm.
you're like 20, 30 years old, or maybe say 30, and someone comes to you and say, you have fibroids and you're not going to be able to have kids. I mean, their mind is
Mm-hmm.
just totally blown that they think, oh my
Right.
God, this is the end of the world, and they'll come to
Right.
you and say, Marty, I plan my future. Everybody plans
Right.
their life, that I go to high school, go to college, I get
Mm-hmm.
married, I have a career, I have,
I have children.
children. And then all of a sudden there's
Mm-hmm.
that bump. When you
Mm-hmm.
get that bump, you're like, oh my God, that bump is like, oh my God, I'm not going to have a kid. And it just shakes
Right.
their entire world. And so that's why
Right.
we say, okay, even though you are a male on this, there's still a
Mm-hmm.
psychological component that's going along with this, to saying, will they be able to have children? And what are the
Right.
options of treatment for fibroids? If I have to take
Right.
somebody's uterus, then they have a psychological thing. Am I a
Yes.
woman still? So those are
That
all the
part.
things that play into it. So that's
But I
why,
think even
people are like, why
so,
is Marty here? And that's why he's
well,
here.
and even Dr. Allen, I think we have to stop putting all of that responsibility on the woman in that regards,
Correct.
that we as men need to be educated on it. We need to know how we can support our women who are maybe in this predicament, and then we need to have a healthier concept about it as well. Because I know in the past I've heard men in my own family or other men in other people's family then attack these women and say, "Well, you're less than a woman." No, they're still
Correct.
100% woman, and so we have a responsibility not to add to or contribute to the depression, the anxiety that could come along as a result of it as well.
Most definitely, you guys have
Mhm.
to understand the female psyche. You have to
Yes,
make sure that you're not putting so much pressure on women to say,
yes,
you have to bear children. And that's not
right,
key. You are a family member, you're a family man, and you're
right,
support a woman in any desire or anything that she has. How would you feel if you find out that you go to have a child and we found it's a male? A woman will never say you're less of a man because you cannot
Hmm.
bear a child. So I
Right.
think those are some of the things that we need to discuss and say, hey, give some of
Most
these women a
definitely.
break. You don't leave them because they don't can't bear a child or they have fibroids and their shape looks a little bit different. We have to support them
Mm.
and have make sure men understand what's really, really going on.
Yeah, I
You
agree.
know,
And as we take the add to the knowledge factor, take the ignorance away from it, so we now can sit down, have this conversation. But I love what you said, that you talked about fibroids, fertility, and your future. That there is so much out there still that we can do. And there's so much more that it does not take a distract from the family at all. I have an adoptive daughter. So, there's always adoptions. There's also fertility. How do we go about to do that? There's so many different ways. Um, I know someone who also carried babies for other women who could not have children like that. So there's lots of
right.
different options that we do have. So thank you for bringing this topic back to us, giving us a little break from the COVID talks,
The
and
COVID
even
talk,
the
correct.
yeah, and even the arguments. There was an argument in my own family versus those who had it, those who didn't. I was like, listen, at this
Right.
point, it's your choice. I know what my choice was. I said, come on, Pfizer, do me good, do me
Right,
good.
right. you know, I am with you on that, because
Right.
people are still out, it's hot outside, people don't have their masks, but
Yes,
like I talked about before, I still have my mask on. I'm still
that's
telling
right.
people wear your mask because I cannot trust that the person sitting next to me or all the
Right.
people that are in my office are vaccinated. So therefore,
Right.
I want to protect me in my future and what I have to offer. So I wear a mask. And I will continue to wear masks until they say
Look.
I don't think I will ever go back to normal. Let's just put it that way.
Wow.
My normal
Wow.
is a mask, and especially when I'm on
Yes.
the plane. I had to fly to
Oh,
Chicago. When
oh,
I was on the plane, I had a full mask on. A grocery store where I don't know people.
you
I'm
know,
fully masked all
people
the
are
time.
people are nasty. Like
Yeah,
Jeremy,
very
they
nasty.
really
Right, right.
they are.
They
So,
are.
yes, yes. Thank you, Jerron. Jerron says, still masking up over here. Definitely. Jerron, definitely.
Most
Thank you,
definitely.
brother. One of the therapists, black male therapists out here in Pomona area. And then Thomas, shout out to Mondo Davis, therapist out in the DMV area. So glad to have it. But Gwen, I know we got another one of
Oh yeah.
our resident doctors on here. So from Chicago, come on, let's welcome to our show again, none other than Dr. Jamie Horn. Dr. Horn, how are you?
Dr.
Hi, how are you guys
Horn.
doing?
Listen,
We are
it's lit for
great,
you in Chicago. Look, you all right?
You know, it's
right?
been it's been raining. We've
Oh
had
wow.
storms, so if my internet goes in and out, I apologize. It's been hot
Yeah.
now and sweaty, so it's been
Right.
a lot going on here too.
Right, right. You're looking
Right.
great,
Right.
Sister Girl. You're looking great.
Oh,
Come on. So, Dr. Horn,
and
how
I'm
have you
tired.
been, and how are you handling, this new normal? Because everyone seems to be so uptight now. It's almost like we let a bunch of cage animals out, and people don't know how to act anymore. But how are you doing, and how are you handling all the pressure, like Dr. Allen says, now that people are coming in and all that?
I'm doing okay. I'm
Okay.
doing okay. Yeah, we've been up and open here in Chicago for a couple weeks now.
Okay.
Like in Los Angeles, people aren't wearing their mask, but I'm still
Mm-hmm.
wearing my mask.
Right.
The hospital is now open. You can
Oh.
have 2 visitors at the hospital when you
Oh
deliver.
God.
We're allowing
Uh-huh.
people to come back in the office. So we're back to normal. I apologize. That's my dog.
Listen.
I'm the only one here with her, and she's
The
going
dog got
crazy.
fibroids, so she wants to
She-
understand what's going on with fibroids and fertility.
Listen, she like, listen, I'm hot too. That's right.
Right.
That's right.
Right.
She thought she got fertility issues. She couldn't
She is
bear
hot.
children, all of that kind of stuff.
I love it. I love it. So, Dr. Allen, for I know women know about this, but a lot of times I'll say we as men have been very ignorant to a lot of the health challenges that especially our Black women have to go through. And I'll even say this on behalf of most of we Black men. We just don't understand. So therefore, we are not empathetic a lot of times because we don't understand the nature of that, what it does to our not just our physical bodies, but to our psychological minds as well. So explain to us we men, because I do have a lot of men who watch, what actually are fibroids and how does it affect women and their health?
Right. Well, first of all, for all the women and the men that are out there, fibroids
Mm-hmm.
are smooth muscle tissues of the uterus. It is a non-cancerous growth that we see in the actual uterus. The uterus is the womb, what people refer to it as, and also is where women bear children. So normally the uterus is at the size of your fist. When you start having fibroids, they get a little,
Mm-hmm.
there's overgrowth muscle tissues that's around the uterus there. You can have them inside, you can have them outside, and you can have them in the
Okay.
canal. And then they're the
Okay.
most common tumor of the uterus. And so, and they occur
Oh.
about 30% in women and over the age of 30, and most commonly in African American women. So if you put
Hmm.
10 African American women in a room, 9 of us will have some form of fibroid tumors. Will they always
Wait.
be? Go
Nine
ahead.
out of 10?
9 out of 10. 9 out of 10 Black women, if
That,
you put us in a room,
that,
that many is
what?
very, very common. And so you guys need to be a little softer on us when you see us and you say, oh my gosh, she has a belly. You don't know if that belly is associated with a pregnancy versus a fibroid versus
We can't
being
do our
fat.
sit-ups. They just go
You,
ahead.
you can't do the sit up again, girl. They
Come on.
won't go
Baby girl, let's
away.
do the sit-ups. I got you. I got you. I got your feet. I got you. Come on.
Right. You can't have me. I'm one of those who sit up there and with a big old belly. I'm just like, oh my God. Because why at the end of the day, that's a fibroid. That's a fibroid. But
Wow.
then we also as African American women need to understand something too. If you put
Mm-hmm.
9 out of 10 Black women in a room,
Mm-hmm.
10 Black women in a room, 9 of us has fibroids. Does that mean that all of us will require some form of surgery?
Okay,
That
good
means
question.
absolutely not. Because if we
Okay.
say if it's a non-cancerous growth, why would I have it
Mm-hmm.
removed? But you have to be
Okay.
realistic on why you want it removed. If your fibroids
Okay.
cause you bleeding or causes some type of pain, some women don't even want to sleep with in the beds with their husbands because it looks like a crime scene. They're sitting up here.
Right,
Men,
right.
you guys are scary anyway. You see a little blood, you
Yeah,
freak
we
out.
are. We
But
are. We are.
sometimes women will have heavier cycles, and those
Okay.
heavier cycles will cause them to bleed heavier and at night. And then you get afraid. You're like, oh my God, I don't want to sleep in the bedroom with my husband, or don't want to do certain things because you're afraid of that
Right.
heavy bleeding. So therefore, we need for you guys to be a little bit more sympathetic and empathetic when a woman is going through that. Because again, like I said, 9 out of 10 Black women will have it, and a third of those women will have symptoms such as vaginal
I,
bleeding,
I
such as
am blown
pelvic
away right
pain,
now.
and emotional services. What you blown away about, Mari?
But I think that's I knew that that our Black women were more I don't want to say susceptible, but the rates were higher. But I did not know that it was that high. 9 out of 10. That's mind blowing to me. If you I could have probably said if you said 50%, I'm like, okay, kind of half and half. But 9 out of 10?
Yeah,
Wow.
9 out of 10, and we're not like 3 to 9 times more common than the Caucasian population. You don't
Mm-hmm.
really see Caucasian women with fibroids, and so then that
Wow.
comes to a discussion like, where do they come from? And like Dr. Horn, where
Right.
do you think they come from? Some people think it's a hereditary component. Some people think it's a dietary change. You as vegan, what do you think about where do they come from? What
Okay.
do you think about that?
I really do believe there is a hereditary component
Mm-hmm.
just
Mm-hmm.
because it is so prominent in our
Right.
communities. I
Right.
think we should back up though. Even though there are a large percentage of women who have fibroids, not all women who have fibroids have an issue. Some
Okay.
fibroids are what
Okay.
we call incidental findings. That
Okay.
meaning they're small, they're the size of peas or smaller
Okay.
than that, and they're not causing problems. So even if you
Okay.
are told that you have fibroids, does not mean that there is necessarily an issue or something
Okay.
needs to be done about it. What I tell my patients is you need to treat your fibroids when they're starting to interfere with your day-to-day life. When it is stopping
Hmm.
you from being you, meaning you don't want to go to work on your cycle, you don't
Okay.
want to leave your house on your cycle, you're
Okay.
wearing adult diapers on your cycle because the bleeding
Wow.
is so heavy. At that time, I feel it's time that you
Time to do
consider some
something.
type of treatment.
Okay.
You asked me about being vegan. Just this week, someone asked me, are there herbal supplements to help treat
Mm-hmm.
fibroids? I don't know about you, Dr. Allen, but I don't know of any herbal supplements that shrink fibroids. We do have
Mm.
medications that can help with fibroids, but in general, Gwen asked about diet. I think
Mm-hmm.
in general, as women, as Black women, we need to have a healthier, cleaner diet, less
Well, I think that's all
processed
black
food,
folk,
less
period.
sugar.
Right,
Period.
right.
Right. I think
Mm-hmm.
if you eat healthier, you'll feel better. Will it shrink fibroids? Probably not, but it
But
will help decrease your BMI. It'll help your
mm-hmm.
cardiac status. And
Help
women who
this.
are overweight tend to have bleeding issues. So the closer you
Mm.
can get your body weight to that so-called ideal body weight, the
Mm-hmm.
better your menstrual cycles will be.
Okay,
Right.
that's interesting to know that. Again, I'm a man. I don't know all that. You got to text us. Say, now, do I get the pads, the tampons, you got to you got to give us a picture and tell us exactly
Right.
what, or we just buy the whole store and be like, here, I didn't know, just pick something.
Pick something
Right.
out of there, right?
Just
Right.
just pick something. I don't know. But how? And knowing that, that makes so much sense now. So not all fibroids are definitely causing them any type of pain or interfering with their daily life activities.
That
Okay,
is correct.
but when they are interfering with them, such as heavy bleeding, not desiring to go to work during those times, or heavy cramping, I would imagine with that as well, then that's when we need to say, hey, uh, Dr. OBGYN, I'm having some problems. And
Right.
let's look at some alternative that we can do, whether it's medication, with a combination maybe with some dieting and exercising. Okay, talk
Mhm.
to me some more. I'm learning a lot. I'm learning a
Right.
lot.
And I think one of the things that we need to understand, though, too. Oh, Dr. Horn just faded to black on
She'll
us,
be
but
back.
she'll be back. There you go. One of the things that you got to see that not all fibroids require surgery, like we talked about
Mm-hmm.
before.
Mm-hmm.
Like there's small fibroids, they're microscopic, but we like to refer to fibroids like fruit. So somebody
Okay.
say, "Oh, I have a 1 centimeter fibroid. That's as big as a peanut. I have a four
Okay.
centimeter fibroid. That's a lime. You have a five
Okay.
centimeter fibroid. That's consistent with like a grapefruit. And then, we refer to a
Wow.
pregnancy. A 20-week size fibroid is something that's above the umbilicus. So if somebody, you put your little index finger in your belly button, and if you feel something hard there, most time it is your fibroid. So that's a 20-week size pregnancy, or what we consider a 5-week size. I mean, a 5 month size pregnancy.
Wow.
Those individual we operate on, because why? They
Okay.
will have problems such as, like we said, heavy cycles,
Mm-hmm.
problems with urination and things like that. And as far as
Mm-hmm.
men are concerned, we have to be a little bit more sympathetic and empathetic, because
Mm-hmm.
what happens is that you guys are now out there taking Viagra, so you want to have sex all the time. Sometimes women, we don't
If
want
you're
to
having
do
high
that. And
blood pressure, you don't need to take that
you don't need
Viagra.
to take
Don't
that,
take
right?
it.
Don't take it.
You'll be dead in the middle of sex.
Right. Tell you about 911. What's your emergency? Took the blue pill. No, I'm joking with
Right.
you on
And I got
that.
high blood pressure.
Right. But see, and you gotta be sympathetic and empathetic, because now the
Right.
women's
Right.
stomach a little bit heavy. And then also positions in sex may be a little bit more difficult for them to have,
Mm.
because of where the location of the fibroids. When we talk about
Mm.
fibroids, we talk about the size, we talk
Okay.
about the location, and
Mm-hmm.
are they causing them bleeding or not, be symptomatic or asymptomatic. And so
Mm-hmm.
women will come to us and say, I want to have a child. What do I do now? Me as an
Mm-hmm.
obstetrician gynecologist, if they are not bothering you, do not bother them. Because if you don't
Oh,
have a fibroid and then you try to have a child, and if we go think about your uterus is like a block of cheese, and this is how I always tell everybody.
okay.
Now, if I take little pieces and turn that block of cheese into
Chunks.
Swiss cheese, right? It's your Swiss. I
Mm-hmm.
just Swiss cheese. I open it all up and I take it out. Now your uterus have these holes in it that I have to sew up. Now, where would a baby
Mm.
implant in that uterus? That baby cannot implant in that uterus, and women will end up with
Mm.
more miscarriages. So, the misconception that people
Mm.
have is that I need to do something about these fibroids so I can get pregnant. No, you try to get pregnant first because that
Wow.
fibroid may be on the outside. You can be
Right.
pregnant and have a fibroid. You can have a normal delivery and have a fibroid. So don't
Wow.
interfere with your uterus because then therefore when you do interfere with it, there's a possibility that now you will become
Okay.
infertile. So leave it
Mm-hmm.
alone. Don't even touch it. And when it becomes symptomatic, then you be able to do something about it. And then treatment of fibroids doesn't necessarily mean a hysterectomy. I will
Oh,
tell you a
that's
story.
good.
Tell you a story about that word, right? When we talk about hysterectomy,
Mm-hmm.
you know, in your field,
Mm-hmm.
what makes me different from you besides, oh, there's a dog again. That means Dr. Horn is back. No, let me quit.
She is.
Right. In your psychological world, what makes it besides, well, men have breasts too, but what's the
Mm-hmm. They
difference
do.
between me and you, right? The difference between you and I is that I have a uterus and you don't
Our
have one.
plumbing.
Right?
Right.
So then, when Freud back in the day, when there were some women who had postpartum depression or mental illness and things like that,
Yes.
he
Yes.
said, what's the difference between a man and a woman? I'm
Mm-hmm.
not crazy, meaning men are
Mm-hmm.
not crazy. So what
Mm-hmm.
that woman is crazy. So what made
Mm-hmm.
that woman crazy? She has a uterus, right?
Right.
Hence the word hysterectomy. You get it? Hysteria. So if I remove her hysteria, if I remove
Oh
her
my God.
uterus,
You
I
better
remove
teach us
her
on tonight.
hysteria, right? So now
Woo.
the hysteria is gone. So basically, that came from male chauvinistic terminology that if I'm going to take this woman's uterus, I will remove the hysteria. So back in the day, a lot of women,
Wow.
including
Shut the
Black
front
women,
door.
right? See that they came from your mental health. Look at that. Remove
Well,
my
listen,
hysteria.
I think he cray, and they call him the father of psychology. Y'all, we know the real deal behind Freud and all them experimentation with nieces and all that other stuff, but we won't go there. We
Right,
won't go
right,
there.
right. But you see how he had the mental health also plays a part into
Mm-hmm.
our world because if you never really
Wow.
thought about hysterectomy means hysteria, and so hysteria, so they thought, well,
Wow.
I would remove this uterus from this woman so she would no longer be
Be
crazy. So a
hysterical.
lot of them,
Wow.
right? Isn't that something? And so
That
now
okay.
people come to the doctor and say, I want my uterus removed because I'm gonna feel better. It is not going to make you
Mm-mm.
feel better. There's other
No.
options out there to cure fibroids and
I
even problems with women.
and this is where the Dr. Allen, you and I always have this amazing discussion about integrative approach to medicine, and Dr. Horn, I know you're on that too because I think we have to include when we're doing something that drastic because that's a drastic surgery is a drastic decision that you have to make, and if I'm hearing you correctly, that should be the last decision
Be
that
the
you have to
last
make,
decision.
the very last. And I definitely am one who believes that what if we had put mental health services, whether it's a woman or someone who understood this a lot better, to couple this with it, how we would have been able to help these women and help the family, because I am so a believer, if you're in a relationship, bring that joker on in here too, bring that husband, bring that wife or whomever in here too, so that we can sit down and have a family treatment plan and family goals
There you
together, because it affects the entire family. And we got to stop as men having the blame game and calling our women, you're less than a woman, you know, all your good parts are gone and all that, because it's not the truth. The good
go.
part is
That is
that they are
correct.
still here alive. The good part is that they are still breathing and still can take care of our butts when we need them to. So
Right.
Thank you. Oh my goodness. That's
Most definitely, because I'm with you with the well-rounded approach, because
mm-hmm.
when we all get together, and
Yes.
if you notice that your wife or somebody like that, that they're tired, the signs of
Yes.
fibroids, that they have anemia, that
Mm.
that they have bleeding all over the place secondary to anemia. But a woman is not going to come to you and say, sweetheart, I done been on my cycle for 14 days. She's not going to
Right.
say that. She won't
Right.
come to you and say, oh my God, my stomach is getting a little bit bigger. I'm protruding from here,
Right.
things like that. Most of the time, we find the fibroids on either on a pelvic examination, or some
Uh-huh.
women are probably doing sit ups and the stomach never really goes away. And that's the pouch that
Okay.
they see. When you come to the gynecologist, we do a pelvic exam. We also put
Mm-hmm.
a speculum in there. And sometimes there may be a
Mm-hmm.
little fibroid polyp that causes that little bleeding, but we
Mm.
have to be in tune with our body. And I
Mm-hmm.
encourage the males to come
Mm-hmm.
in and talk to the doctors about
Yes.
that, because most of you guys will put the pressure on the woman to say, let's have a child, let's have a child. But if they don't
Mm-hmm.
understand the mechanism of this process and what's going on, the psychological effect of this woman trying to have a child, I might have to get rid of my uterus, I got fibroids.
Yes.
It causes so many family dynamics, and it becomes a
Mm-hmm.
problem later on down the line. So I
And Dr.
think
Horn,
we like the holistic approach. I'm
yeah,
sorry.
and no, you're fine. Because where I was going with this is a lot of times we don't. I would say it this way: stress has to come out somewhere. And if we're trying, if we now we're stressed out behind this, and now we're having this, we're pregnant, or the thought of having pregnant. So now you're feeling all this stress, this pressure, and all of that. And y'all tell me, definitely. My theory is this: that because everyone is so stressed, especially the woman who's now carrying, that the likelihood of having a miscarriage has now increased because your body is always in this tension mode because we have not properly reduced the stress in it. Now, I could be wrong, but that's my theory because I think stress comes out in so different many ways. We had Jeff on here a couple of weeks ago, and we heard how stress caused him to have a stroke. And I believe that stress, and y'all tell me if I'm right or wrong in that, but that high stress can cause miscarriages and so forth.
I think high stress causes a lot of issues,
Yes.
especially with your cycle. Women that I
Yes.
know are going through a stressful part of their time, either they're not having a
Mm,
cycle or they're having a crazy cycle. So mental
right.
health does play a big role. Also, on the
Mm,
opposite end, though, women who are going through it, meaning they're having these heavy cycles, they're cramping a lot. I've had several patients come back after I've done a hysterectomy and say that they have a new life.
mm-hmm,
Gwen, a very close friend of ours that I did her hysterectomy on, and she
mm-hmm,
is like, I'm a new person. Like my life
mm,
is just so much better. Meaning she
mm.
bled all the time, always had a lot of pain, was scared to leave her house without having her accoutrements of, things to
Ooh,
prepare for.
accoutrements.
The word of the day on
The word of the day,
the word of the day
You
on
know,
house calls is accoutrements. Yes.
accoutrements.
What did I call it?
but
Accoutrements?
truly, when you have to bring a
Right.
change of clothes when you're leaving your house,
Yeah.
that's a bit much. That is a
Yeah.
bit
Right,
much.
right, right,
So
right, right.
it can change your life. It
Yes.
truly, if you are having a lot of problems with your cycle, go see your doctor because
Mm-hmm.
Right.
a treatment can truly change your life, improve your
Wow.
quality of life. And I've seen
I
it. I'm
love.
sure you've seen it a lot too, Dr. Allen. I've seen it
Right.
tons of times where patients come back and just say, I can't believe why didn't I do this sooner? I was
Yeah.
scared to do
Why?
it. Why
Yeah.
didn't I
There
do
we
it sooner?
go. Why are we so afraid to have this type of conversation at the dinner table, drinking at
Mhm.
Starbucks, amongst
Right.
mixed company, at the cigar lounge, while we're drinking some bourbon or something? I don't know. Why are
Right.
we
Right.
afraid to have these conversations in our communities? I always say it this way: we have to stop secretly suffering in silence. We've been doing it for so long. I don't know, Dr. Allen. Thank you guys for having this
You
conversation
know
because
what?
I've learned so much. Go ahead.
I know one reason. A lot of people think that's how it's supposed to be. Meaning, my mom had heavy
Mm,
cycles and cramped a lot.
right.
They think that's just how it's supposed to be. I know as a young girl, I remember I don't know, remember how old my mom was, but I remember we were getting our hair done.
Right.
And my mom had fibroids and she ended up having a hysterectomy. But before she had her hysterectomy, she had bled through her clothes. And my hair wasn't finished. And we had to go. And I just remember, like, what the hell? My hair's not finished. Why are we leaving? She had to, she had bled through her clothes and she had to leave. So I think if I would have, seen that with my mom and she hadn't gotten treatment, I might have thought, oh, that's just how my cycles are supposed to be. This is just what we're supposed to go through, when it's not. Things have changed. My mom had that hysterectomy in the 70s. Yeah, because I don't even think I was in high school yet. But things have changed dramatically. There's robotics, you can be in and out, there's ablation, there's all kind of things. There's non-surgical treatments, stuff that's done with radiology, uterine artery embolization. There are tons of treatments out there, from minimally invasive stuff to taking your uterus out. So you have options. So I just want to stress to people, go see your gynecologist and see a gynecologist, not your family practitioner.
There you go.
No specialty, no shade at all, but see someone who can correct your problem.
Your problem, right. And I think the most important thing is that, like Dr. Horn said, is that see a gynecologist. And a hysterectomy is not your first option. It's actually your last option. And like
that's
you said,
good.
when we come in, we sit at the table, we take a look at your CT scan, MRI, ultrasound. Then we figure out what your problems are. Some people may need a myomectomy where we just take each individual fibroid. Some person may need a hysterectomy because the uterus is so enlarged, it's comment on the, it's making them have back pain because it's messing up other organs in their body. But again, people have to understand that it is their choice. It does not make you infertile. So when you have fibroids, you can ask for what we call a HSG, a hysterosalpingogram. If that fibroid is not blocking the tubes, therefore go and try to get pregnant. You don't have to have that fibroid removed. You have to try to get pregnant first. And then if you can't, if it's blocking that tube, then we may suggest let's remove that fibroid, but that's under the direction of the doctor and you will have a plan of action. Let's remove the fibroid. Put you on fertility drugs, let's get you pregnant, and that's how it goes. Then the next question will be, doctor, if I had a myomectomy, do I have to have a C-section? For me, yes, because I don't like it, depending on where that fibroid was removed from. If it was removed in the part of the uterus that causes contractions, yes, I will say you need to have a hysterectomy. Not a hysterectomy, a C-section. However, if it's one of those fibroids that's hanging off to the side and the uterus is my body and the fibroid is just hanging like this, no, you don't need to.
I love the analogy.
You can just, we're going to take this off and the rest of the fridge is going to be your body here. And you can have a normal delivery. I want women of color especially, to know that hysterectomy is your last option and not your first. That's good. You would be surprised at how many times people come to my office and I say, why did you have surgery? And they were like, I don't know. And I feel like, Scooby-Doo, because the first thing they say is, you don't know why someone took out a vital organ? Well, they said I was bleeding. Well, what are the options did you have? They didn't give me any options. What did they take out? I don't know. I don't know.
Wow. Thank you.
Don't ever let anyone cut on you and not know what they did, what was taken out. That's one of my pet. Women will come and say, I had a partial hysterectomy. What exactly do you mean by partial hysterectomy?
Right, because I've heard that word tossed around.
So hysterectomy means uterus. So when you say to a physician, partial hysterectomy, that means you took out part of the uterus. But I think in their mind, they mean I left the tubes and ovaries. But it's important that you know the terminology. And if you don't understand, ask your doctor to repeat it. 1 time, 2 times, 3 times, 4 times. Do not leave the office until you understand every single thing. And your doctor will explain it to you. That your doctor will think of other language so that you understand what's going on. As a provider, I don't mind when patients ask me to re-explain it. Well, could you tell me one more
Mm-hmm.
time?
Mm-hmm.
Draw me a picture. Do all those things so that you leave the office fully understanding what is going to happen or what has happened to you.
Mm-hmm.
Right.
See, even the dog agrees.
Right. The dog is actually agreeing very much so tonight. But I agree with Dr. Horn, and let's talk about the types. Again,
Mm-hmm.
when
Okay.
somebody comes to me and say partial hysterectomy, I'm like, okay, you need to understand that did they leave your cervix or did they keep your cervix? Because for us, like
Mm-hmm.
Dr. Horn said, hysterectomy, I'm taking the uterus. So
Mm-hmm.
when we say total abdominal hysterectomy, I get this all the time. You told me I was going to have a partial, but I'm taking total abdominal mean I'm taking all of your uterus. I did not say bilateral salpingo oophorectomy. That means
Ooh.
I'm taking your tubes and ovaries. So when I say you having a hysterectomy, I'm taking your uterus. When I didn't say bilateral oophorectomy, I'm not taking your ovaries. But the recommendations now by our ACOG, by our standards, is that when you have your uterus removed or you have a
Mm-hmm.
tubal ligation, we must now take your tubes because we don't want you to end up with cancer of the tubes and things of that nature, and even possibly the
Mm.
ovaries. So therefore, we have to remove the tubes at the time of surgery. So like Dr. Horn says, we have to know what's happening. But again, it is your choice. You come in, you say, ask the doctor to explain, draw where the fibroids are. Is it inhibiting anything? Is it a dollar size, quarter size, grapefruit size, baby size? Then the next question is, do I have to have them removed? No, I do
Mm-hmm.
not have to remove because they are not cancerous organisms. They do not turn to cancer. You don't.
Mm-hmm.
So speak with your doctor, talk to your doctor, and be your advocate. I'm not saying hold on to the uterus that's at your throat because you bleeding to death and you're in the emergency room because you are
Right. Right.
now
Right.
bleeding to death. I'm not saying that, but you make the best choices for you at the time. Then some people go, okay, well, you got a 20-week size uterus. Remember, I told you the 20 weeks is at the size of the
Mm-hmm.
belly,
Mm-hmm.
looking like you're pregnant. Okay, I'm going to change my diet and I'm going to use some herbs. There are not herbs out there, and there's not dietary changes that will stop that growth. Once that growth is there, it's there. Now, somebody said, well,
Mm-hmm.
I went to the doctor and they did my pelvic exam and they didn't tell me I had a fibroid. No, they did your pap smear because they put that little silver
Mm-hmm.
thing or that clear thing in the vagina
Mm-hmm.
and open up so you can see the speculum. But they did
Mm-hmm.
not put their hands inside there, but what we call a bimanual examination in order to feel the fibroids. Because fibroids don't come overnight. When you have something that's a grapefruit size, that has been there for at least 5 to 10
For
years before it was even discovered.
wow.
So we said most
Wow.
childbearing women will have some fibroids. My own theory believes that there is some dietary components because it's very prevalent in the African American population,
Mm-hmm.
in which we see a lot of fast food, carbohydrates, and trans fat. So there may be a dietary
A
component, but as
linkage.
you said,
Uh-huh.
right, there's no studies that have been done on there, so we don't really know. So probably in the
Mm.
African American community, we may start looking at these things to figure out why. It is not a majority disease, so therefore there's not much resources or anybody trying to look into the reason why African American women or women of color have it. Now I'm starting to see in my Hispanic population, they are having
Wow.
fibroids just like we do. But those are Hispanics who are now who coming in eating like we eating the fried chicken, the greens, and all that kind of stuff, and not sticking to some traditional thing. And you're like, wow, your dietary change. So I do believe at some point we will find later on down the line that there will be uh,
Well, we
um,
need a fellowship or
dietary
something for someone
components.
to
It's
fund
the
this
bacon.
study for y'all.
Exactly. I
Mm-hmm.
agree with you on that. And because we need to figure out what's going on. I know
Right.
I'm talking my head off, but we also need to tell our patients like their options, your options. Just because you're
Yes.
bleeding, I don't necessarily need to take your uterus. I can give
Mm.
you either what we call Depo-Provera, that's a shot, or Depo-Lupron. Depo-Lupron is what we call like agonist. We put them through menopause. We put them through early
Oh
menopause.
God.
And what that will do, right? We're going to have hot flashes, night sweat, mood sweat, but you won't be bleeding. You will not be bleeding. We can get your
Woo.
anemia up and things of that nature. And it gives you an opportunity to figure out what you want to do. We can also
Okay.
put a progesterone IUD inside to stop the bleeding so you can figure out, okay,
Okay.
again, these are my options. It's not a drastic matter. We go from
Mm-hmm.
least invasive to the
There we
invasive in
go.
order,
There we
and
go.
so therefore you can take control of your life and then decide, okay, when you are ready. I never rush a patient because I don't want
Mm-hmm.
everyone to ever think that I am taking their option away from
There
them.
we go.
When
There
you're
we go.
ready to let go of that uterus, you will. You're like, okay, it's time. I have exhausted all possibilities and now it's time. But that's a thing like we talked
Yeah.
about before. It's a family thing. It's between the
Yes.
wife, the husband, and everybody come to collectively and say,
Family voice
this is
and
what we're
choice.
going to find. Exactly. Oh, I like that. Family voice and choice. I like that. I'm going to have to
Hmm.
use that.
Yeah, yeah, use that. That's a wraparound component. But yes, yes, definitely. So, Dr. Horn, would you want to add anything to what Dr. Allen was saying about, just I love the choice and really taking the stigma away from it?
Right. I agree with Dr. Allen. When you're ready to get treatment, go see your provider. And patients will come to me and say, I don't want to try anything. I'm just
Mm-hmm.
done with it.
Mm-hmm.
I
Mm-hmm.
still discuss with them options, but I'm going to say 9 times out of 10, when a woman says she is done, she is done. And when she's
Mm-hmm.
done, she's meaning take out my uterus. And then we talk
Okay.
about the different types of hysterectomies because you even have options on the type of hysterectomy you
Okay.
have, depending on the size of your uterus. I tell women, if you're going to do it when your uterus is smaller than before it gets up to your throat. When it gets that
Mm.
high, you have lost a lot of your options. You've lost your
Mm.
surgically minimally invasive options.
Mm-hmm.
I called Dr. Allen this morning because I did a hysterectomy on a patient whose uterus was extremely large and she kind of missed that opportunity for a minimally invasive procedure. So I called Dr. Allen, okay, like pump me up, because this is a big uterus. So, and I'm happy to say her procedure went fine, but she was one of those women that were like, I'm gonna wait and see, wait and see. And then one day in April, she ended up in the ED with a lot of pain and bleeding, and she decided enough was enough. So every
Yeah.
woman gets to that point where she says enough is enough.
Thank you. Let's look at Paula's comment. Do you want to respond to any of that, Dr. Allen? And
Yeah, I
Paula's one of
mean,
our super followers who watches us. So hello, Paula.
hi, Paula. Thank you again, and for always, giving us the great comments. I mean,
Mm-hmm.
actually, it was really interesting. I was on ER call last night, and I was able to save a young lady's tooth because, again,
Mm.
one of the things that I want to express to women of color, I think I won't say the only people who understand you, but I think we have a better relationship to
Right,
understand that
right.
when someone saved your tubes, they gave you an opportunity to reproduce. Sometimes men don't
Yes.
understand that mentally,
We
that
don't.
if I take away that option for a woman, I will send her down this spiral of depression
Mm-hmm.
to not be
Mm-hmm.
able to bear children. And so thank God that you had a doctor. When ectopic pregnancy, if those who don't know, is that the baby got stuck in the tube. And once the baby got stuck in the tube, it can't grow there because the baby tends to grow rapidly and the tube is no
Mm-hmm.
bigger than an ink pen. And a baby can't grow in this. So the tube kind of ruptured. So what we do is a procedure called salpingostomy, where we just open up the tube a little bit, take out the pregnancy, and we leave and sew the tube up or leave it open so and then that person can conceive again. So I'm glad, Paula, that you had one. You're very lucky to
Mm.
have two ectopics and still be
Right.
able to bear children and still have your uterus, because that's a very, very dangerous procedure. And I say again, I commend you, and I hope you did have a woman of color or anyone of color, because we extend that. The reason why we're having this conversation today is because a lot of African American women and women of color back in the 70s and 80s, their
Mm-hmm.
uterus was removed without any options. You have
Mm-hmm.
options that you can take control of your
Mm.
life. And we're here to tell you that take control and have options so you can reproduce.
Yes.
Because you have to talk to that particular physician. And I tell people that all the time. When they say, what would you do? It's not my body. I can always give you,
Mm-hmm.
I am going to inform you of a consent. This is your informed consent. This is what you can do and how you can do it.
Mm.
However, you need to make your own decisions because that's the one that you will have to live with. And then once people come to me all the time, God gave me that uterus. Okay, you can keep that uterus. But as long, and God also gave you common sense when that uterus start failing you, then therefore we need to do something about it. But, again, I am glad that Paula was able to reproduce. And
Yes.
most women want to have children and preserve as much as you can. And I'm happy that it happened for her.
And her 17-year-old just graduated from high school last week, so she got to see him graduate from high school. So again, Paula, we love you, darling, out there in Connecticut, Hartford, Connecticut. She's just doing
Hartford,
amazing
Connecticut.
work. Yeah, she's out in Connecticut, and she's had me on Voya. So definitely, Paula, a cheap shout out and plug. Dr. Allen and Dr. Horn would love to speak to the Voya African American group about their health and wellness. So yes, Voya Financing Group. Yes, they will come and speak. So yes, but glad to have you. Can you believe our time is almost up there? But this has been so. What kind of future? Again, I know you've already said it, but I think we want to close on this upbeat note that because they've had, fibroids does not mean the end, that there still
Correct.
can be a bright future in front. I've learned so much today as a Black man that you're going to be able to help me to be able to even treat my patients in a different capacity as well. So thank you. She said that would be wonderful. Have you guys come and speak up? Well, yes, they'll do it. They'll
Most
do it.
definitely,
Yes.
most definitely, just give us a heads up. We'll do it. I love to travel. As long as you have good food, I'll be there eating. So,
Oh, wait a minute. I had to do mine via Zoom. Paula, I can travel too.
oh, look, we're no longer zooming anymore. We're out to travel. No, I'm joking with you.
Right. Dr. Horn, what words of hope would you give a woman who might be going through these challenges today again?
I would say see your physician. One thing that
Mm-hmm.
Dr. Allen said that patients tell her is, God wants me to keep this uterus. When patients tell me that, I always say, well, did you ever consider God brought you to me to let you become aware of all your options? So
Wow,
you
that's
have
good.
options, and God led you to me to give you those options and to give you those
Mm,
choices. So again, my whole point in all of this is to say, if you're having problems with your cycles, if you think you have fibroids, go see your gynecologist. And please make sure you understand each and everything that provider tells you before you leave. Before you have surgery, make sure you know what the plan is, what's going to be taken out, what's going to be left.
that's
After you
good.
have surgery, make sure you understand what was left, what was taken out, and have it explained to you in plain English so that you'll understand the day you leave the hospital and you'll understand 5 to 10 years down the line when you're seeing another provider.
Hmm. So we had one more. Trisha, where you been? You got in here late. It says, after childbearing years, how quickly do fibroids grow from the initial discovery, or how often should they have them checked if that you
That
have
you
them?
have five,
I
five, right?
uh huh uh huh.
Yep. Fibroids is my specialty. I operate almost every day. I love it. I love to spare women's fertility. That's one of the things that I do.
Mm-hmm.
When we first discover them, we follow them every 6 months to a year. If you're asymptomatic, we see you in 6 months, make sure they're not growing, teach you about the signs and symptom of it, make sure you're not bleeding, the pelvic pain and increasing urination.
Mm-hmm.
After menopause, which is another interesting thing, is that after menopause, if you are not having a cycle, fibroids do not continue to grow. They will stay the same size that they are, and they will be that way, and they will calcify. But once we discover one, like say if we find one that's the size of a peanut, like I talked to before, which was
Mm-hmm.
probably like 1.5 centimeter. They're slow growing tumors. So they don't get to a big size of a grapefruit until about 5 years. So they are
Mm.
slow growing tumors. So when you get to a big stomach and all that kind of stuff, that fibroid have been there for years. I have a 54-year-old fibroid, and we've been knowing each other for a good long time now. So
Dr. Horn, what you gonna do with Dr. Allen?
It needs to go.
We have come.
It
We're
ain't
very
bothering me.
attached to one
I
that
ain't
it's
bothering
not.
me.
And not exactly. And I tell my patient that the whole time. I can camouflage a good while. The Dr. Horn think I look like I have kwashiorkor, but anyway, that's the whole thing. But I think people need to understand when we talked about when it's time to go, it's time to go. But I've attacked mine. We're good. We're good friends. They no longer sucking the life out of me. They're no longer parasitic. But far as
I can't.
cosmetic wise, I may be looking like I'm like in my 9th month, but I think I wear it very well. No, so those individuals who do have it, I still encourage you to see your physician and then make the proper choices. And right now, my choice is to hold on for dear life. No, I'm joking with you, Dr. Horn.
Well, I guess Dr. Horn, if she's gonna have the procedure, he'll call you and have you do the procedure.
I told her, on that note, I told her she knows that I would always, she said she'll come to LA, she'll come to things like that. But I'm one of those individuals I'm asymptomatic. So therefore, I'm at a point, I was symptomatic at one point and now I'm asymptomatic. So out of sight, out of mind, it comes to a point like, oh yeah, I do have those. But for those individuals, you see, it doesn't turn to cancer. It did not stop my quality of life. I can still operate on people, and sometimes I use it as holding a retractor. But no, I'm joking with you, but it's not
good. I can't. Dr. Horn, she and I went to undergrad together. Oh my God. She's been the same way since we got out of high school.
Right.
Well, listen, as always, I just love it. And Dr. McKinney, she missed it. I would have loved to hear her comments. Lord have mercy.
Have mercy, right?
We are so glad, and thank you both for always being on here, for always educating our community on what we can do and how we can improve our health and wellness with that. So, guys, we want to thank you again for joining us for another edition of Mental Health Matters with Marty, featuring house calls with the doctors. You've heard it here. We've learned again that for especially African-American women, 9 out of 10 of them do have fibroids. However, they don't have to be removed via surgery, that you can't have a productive life. If it's bothering you and changing the quality of your life and impeding upon it, you definitely need to be seeing your gynecologist. Again, we want to promote healthy living, healthy mental health, healthy physical health, healthy spiritual health, and everything we do to be healthy, because too many of us are continuing to secretly suffer in silence in the shadow of shame. But as always, Daryl, we're closing right out tonight. We want you to speak up. We want you to speak out. But more importantly, we want you to live. And as always, to remember to enjoy your life. We'll see you on Tuesday. Take care.
Enjoy your life.